you have a skull bone, and also if you have a sagittal section, it's not. You do, most of us, if we possess individual bones, we are not having a sagittal section. So a skull costs 25 to 30,000. So I would ask you to again buy a skull for anatomy. You have enough time, you just see it in the lab. এই 2 মাস তোমার যেটুকু থাকবে, revision থাকবে, sit tight. And also you use your gadgets. Also you download some good, like two. One is that for astrology, you read Chaurasia, you read Ashim Datto, your Vishram Singh, Indrabir Singh, and your Shamar Mitra. You have that book in your side. You have a notebook, khata boro, and also the bones you study together. But the lecture, what you today, whoever presented, ajke just read and draw and complete. And after 10 lunch and dinner, you study it in groups. একটা 4 জনের 2 জনের গ্রুপ, হ্যাঁ, এটা পড়লে কি হবে, ঘুম আসবে না। এই দেখ বলতো কোথায় এটা প্যারানাসাল সাইনাসটা কোথায়, which is the occipital bone, describe the occipital bone, which is the mastoid. আর এখন এই কাপড়ের division for any upper limb, lower limb. So what is the knee joint, what is the action of locking and unlocking, what is the role of the popliteal ligament, a tendon of popliteus is extrasynovial or intersynovial. You understand? You just exchange and study. Okay. Now, this is a skull, human skull. You say human skull. Skull of a goat, or skull of a rabbit, or skull of a gorilla or monkey. It can be. We don't have that much, but I had a dream that if I get a chance, I would have done it. But I have a comparative anatomy. But only when you go to London, definitely visit Hunterian Museum of London, Royal College. It is dedicated in the name of John Hunter. Now, with this, just whatever you say, you see. Now, the total surface, you see it like this. The bones are articulating and contributing to the Norma Basalis today. And the inferior surface of the skull. It is the inferior surface of the skull with different holes are there. I'm just saying. And now, this part, it extends from here up to the superior, highest nuchal line. That is the Norma Basalis. The upper jaw, you have to hold it. Now, this is when you are describing, that is the difference. When Norma Basalis, you hold it like this. Or the examiner asks you, please show me the Norma Basalis. Cut could have been Norma lateralis, Norma frontalis, যেটা তোমাদের ক্লাস ইয়েতে দিয়েছে। Now, but each bone, when it becomes easy, when you try to assemble the bones of the skull. Now, see, you will be finding তো ফ্রন্টাল বোন এগুলো হয়ে গেছে, তো অক্সিপিটাল বোন, টেম্পোরাল বোন হয়ে গেছে, তাহলে তোমরা দেখে নিয়েছো, তাহলে তোমার আর দেখানোর, আমি ভেবেছিলাম যে what is this bone? Maxilla. ম্যাক্সিলা তো কি করে চিনবি? আরে বাবু বাবু এই দেখো দাঁত দাঁত আর ম্যান্ডিবলটা আলাদা। এই দাদা দাঁত দাঁত ম্যান্ডিবল আর এই যে নর্মা ব্যাসিলিস এই যে এটা আছে সেখানে উইদাউট দি ম্যান্ডিবল, get it, without the mandible. Now that is the maxilla. Okay, just at a swift recall revision যা বলবে তুমি চটচট করে বাদ বাকি তোমার তো বাড়িতে পড়বে। একবার দেখে নাও এটা কি বোন? That's a temporal bone. Now, as we are going to read, this is the frontal bone. Okay, এরকম bone. Now you don't mix up. Now these bones are. This is the frontal bone. This is the occipital bone. এটাকে আবার frontal bone বলবে না, because see the frontal lobes of the brain is placed there. Naturally, it has to accommodate. It is more big in the sense the depression or the cavity, cranial cavity. Now, it's the deep thing. Now, over here, this is the occipital lobe. This also accommodates the posterior lobe of the brain. বুঝা গেল? বুঝে গেল? পাঠাও এই পাঠাও, এক এক করে পাঠাও, খালি ছুঁয়ে দেখো দেখো পাঠাও দেখে নাও একবার। ওকে, নাও প্যারাইটাল বোন দেখেন, প্যারাইটাল বোন ঠিক আছে। এই পেছনে তোমাদের বন্ধুদের দাও, দেখো আর বন্ধুদেরকে সাপ্লাই করো। ফেরত দেবে আমাকে। এটা মোর দেন গোল্ড, মোর দেন হোয়াট ইজ দিস? zygomatic bone. This is the sphenoid. ঠিক আছে, তোর তো কনফিডেন্ট, ঠিক আছে। Now all these bones, they are contributing to the formation of the skull. They are attached together, or they comprise the skull, and they attach with sutures. Okay, it is serrated. You can see the serrated sutures. See the sutures. See, each is here, sutures, zygomatic bone sutures. This is the temporal bone, the external auditory meatus, the zygomatic arch. This is also joined with this. Now that you see is that it is like this. You see, this is the sagittal section, and this is these individual bones are articulated with the suture, serrated. This is serrated, মানে করাতের মতন serrated. ঠিক আছে, এবার দাও। Now this is the base of the skull, Norma Basalis. Okay. Now, what are the components that are maxilla? Now, over here, I think this is an old person because the sockets are not there. Edentulus. The sockets are being absorbed. Okay. But there's one small socket. So, this is the maxilla. Hey, maxilla. You see the sockets. ঠিক আছে এই দেখো সকেটস এটার সকেট গুলো নেই মানে ইটস এন एजेड স্কাল তার দাঁত পড়ে গেছে उसका दांत निकल गया okay and it can happen also when you should do some fight okay now what I want to say is that the sockets will be there and you hold it like this. This is Norma Basalis and the bony constituents, the components that is making this base of the skull. I have given you the individual bones. Each bone is contributing to some extent. Okay, the parietal bone doesn't take part. এই ছোট বোনগুলো দিয়ে দাও now this is divided into 3 portions. Okay, now you can see this is the maxilla. I showed you the maxilla. This is the palatine bone. This is zygomatic arch. Okay, now the lateral pterygoid plate. This is sphenoid. This is sphenoid in this part, this portion. This is sphenoid, and this is zygomatic arch. You can see this. The zygomatic arch is there, and the foramen magnum. The foramen magnum is both in the foramen magnum and the condyles. Now the bones see the mastoid process, the foramen magnum, occipital bone, and the bony condyles. Now that articulates the vertebral axis and in the skull you see axis and atlas, the axis. Now, this is one part. The mastoid process, and the jugular foramen is here. Jugular foramen. Now, if you go to the lateral pterygoid plate, there is foramen ovale and foramen spinosum. Foramen ovale and foramen spinosum. Now, these measure the jugular foramen, your foramen ovale and foramen spinosum, and the foramen magnum. The structures passing through these minute, there are lots of things if they won't be asking you. Even in long questions, it usually doesn't come. But main thing is that the foramen magnum, jugular foramen, and your foramen ovale, foramen spinosum. These are the components that has to be focused. It can come as a short note, it can come as an MCQ, and accordingly you have to write and mug up, practice. There are beautiful books you are possessing, and don't try to buy any new information. Don't enroll in your Jaidi classes, MOOC classes, online classes. You will get killed. self-study and group study. This is the greatest motto of medical studies. Online ja hobar hoye geche. And there are some books that last year one of your didis came to me, sir, এই বইটা পড়লে কি আমার পাস করা যাবে? আমি বললাম, ভাই এটা তো আমি বলতে পারবো না। টাচ অ্যান্ড পাস जैसे बोलते हैं ना questions, you cannot. Whatever you have read, you have now it's time of study, sitting down, settling, and then study. And you have to see the foramen magnum now, and the foramen oval. See, the foramen oval has what? The male, M-A-L-E, male. Okay, foramen oval, M for mandibular nerve, A for accessory meningeal artery, L for lesser petrosal nerve, E for emissary vein. Now, spinosum and the spinosum near spines of sphenoid, the middle meningeal artery, and your nervous spinosus, parietal trunk of the branch of the mandibular artery and the middle meningeal vein. Posterolateral foramen, veil. Now, veil, you can see the male foramen oval, it is the spinosum near spino of the sphenoid. Now, the highest nuclear line is here. The protuberance. Okay. Now, superior nuchal line and inferior nuchal line, and the two condyles, the foramen magnum, that this whole thing up to up to this part. And the posterior concha, to the ethmoid bones and all this, your nasal bones that constitute your nose, they take participate here, and all this, the major foramens and that structures passing through it. In the examination, you might be asked to, that I told you in the lecture, like this year, circle of Willis. ওরকম একটা স্কাল রেখে দিয়ে 2-4 লেবেল করে দিল। You get it? What I am understanding? Now that you have to do. But you find minor order this thing now. Ever you can see the external auditory meatus. Now, the mastoid process. Now you see, you hold it like this. The nasal, your concha on the posterior aspect, the foramen magnum in the posterior aspect, you hold it like this. Please describe the Norma Basalis. Now, Norma Basalis, the bones constituting the Norma Basalis, and your anatomical position, and I would say foramens, and what are the major parts, the jugular foramen, the foramen ovale, foramen spinosum, the structures passing through these, and the orbital fissures. Today's lecture, I told you the orbital fissures. What are the structures passing through the orbital fissure? These are the points you have to note. And the palate, and this is the pterygoid plates. And these, what are the muscles attached to the pterygoid plates? When you read head neck dissection, then the muscles will be, you will be studying from the pterygoid plate what are the muscles, And in the base, what are the structures? There is some neck muscles are all put in the যেমন এখানে এখানে টেম্পোরাল মাসলস আছে, তেমনি নেক মাসলস গুলো কিন্তু সব এখানে ট্রেপিজিয়াস থেকে আরম্ভ করে বেস অফ দি স্কাল এখান থেকে পেছন থেকে আসছে। When you dissect, you will get another chance to correlate the muscular attachments at the base of the skull, the Norma Basalis.